Hi, my name is Anu Verma and I am a student of FNP student of US University. I am here to examine your head, neck and ENT. Please give me your full name and date of birth.
Roger, Ontario, March 12, 62.
Thank you very much. I would like to get your permission so that I can do your exam today, record a video, upload it on YouTube as a unlisted, and so that my instructor can watch it and evaluate me.
Sure, go ahead, please.
Thank you so much. We are going to start with your head exam first. For the head exam, I am going to actually visualize, and I am inspecting your head is normocephalic and very symmetric. Looking at your hair is dry, somewhat on the drier side, but otherwise they are straight and they are equally distributed. You do have some baldness coming up in your as a male pattern baldness. Coming down to your now, that's about your hair, and there's no dandruff present. I'm going to come back to your, do you have any pain in your scalp?
No.
I'm going to palpate your head, and I don't see any lumps or bumps. I don't see any injury or trauma marks. I do not see any indentations, any history of scars. Now we're going to examine your eyes. For your eye examination, first of all, I'm going to check your visual acuity. For that, I'm going to get my Snellen pocket chart. The Snellen pocket chart, I'm going to put it I'm going to put it like 6 feet away from you. You're going to cover your eyes with one hand. Cover one eye. Cover one eye with one hand. Exactly. And then you start reading from the bottom up.
L T F P H C F D H J E P T Z O.
Good, awesome. Now you're going to switch to the other side, please, and you're going to read the same thing.
L T F P H C F D H J.
Thank you so much. Very good. Now you're going to read with both eyes for me.
L T F P H C F D H J.
Okay. Thank you so much. So you passed the your eye acuity test, and your vision is 90 by 90 with those glasses. No, 20 by 20. Sorry, with those glasses. We put this. We are considering that we put this Snellen chart at 6 feet. If this was a bigger, the regular chart, standardized chart, then we will put it at 20 feet. Now I'm going to do your visual field of confrontation exam. In this one, I'm going to see how your peripheral vision is as compared to mine. So I'm going to setting in front of you with at the same level, and you're going to be seeing whatever items you see in the periphery. We're going to see one side each time, and then we're going to see both the eyes together. So let's cover. I'm going to have you cover your left eye, my right, my left, your right, and I'm going to go. Can you tell me how many numbers fingers moving?
2.
No.
1.
Let's switch, please.
1, 2.
Good, awesome. Now I'm going to check your peripheral vision, for which I'm going to take my hands superior and posterior to your plane, and I'm going to bring my fingers out. You tell me when you're able to see.
I can see.
Okay, very good. So that the patient does have good peripheral vision, which is a very positive sign. Next, I'm going to really examine your eyes, and I see your eyebrows are very much in place and symmetric. Your eyelashes do not have any scabs or any scaliness right there. Your eyes are not protruding. They are very much in place. Your eyelids are not drooping or any sign of ptosis there. And let's examine your examine the eye. I'm going to examine the eye, and I see that the conjunctiva is nice and pink. Your sclera is white, and it's not yellowish or bloody. Let me check your lacrimal glands. Your lacrimal glands are soft, and there's no sign of infection there. I do not see any corneal problem. The cornea is nice and shiny. I see that your iris is round and it is brown in color, and your pupil is small, and it has your pupil is less than 5 millimeters. And talking of pupil, let's check the pupillary response. So we will check your pupillary reflexes, and I'm going to check your direct and your consensus reflex. In this one, I'm going to shine the light in your left eye, and I see your left pupil constricting for the direct response. And then I shine into the right eye, and I see your right pupil constricting. For the consensus pupillary reflex, we see the light shining in your left eye, and I'm seeing your right pupil constricting. For the when I shine the right light into the right eye, your left pupil is constricting. Thank you very much. That concludes my pupillary reflexes. Now I'm going to check the 6 cardinal views, which is the extraocular motions of the eye. Here I'm checking the cranial nerve 3rd, 4th, and the 6th cranial nerve. I'm going to have you follow the eye, follow my finger. So if you can look at the finger, please. I'm going to make a figure of H, and you're going to follow that. So I'm on the left extreme, coming to the middle, going up, going down, moving to the middle, going forward, going up, going down, and then going out. Very good. I saw that your eyes were moving very smoothly, which is a good sign. Now I'm going to bring my finger close to the ridge of your nose, and I'm seeing your eyes are converging. For the convergence test, I'm going to bring the eyes, close your nose, and then you tell me when it is becoming 2. Okay, awesome. So his convergence is under 3 inches, which is normal. I also saw that his pupils were constricting as my finger went close to him, which is good. For nystagmus test, I'm going to have you look towards my hand here, look to the side, and then look to the side. Yes. So I see that he does not have any nystagmus. His eyes are not shaking. It's very smooth movements. All the muscles are under control and coordinated. And he has good accommodation, because as I was bringing his as I was seeing, as he was able to see far, and he was able to see close by. My next exam for him, that concludes my eye exam for him, and now I am going to actually do the ophthalmoscopic exam, which is actually an important exam. And let me find my ophthalmoscope. In my ophthalmoscopic exam, I am going to go close to the patient. So I'm going to examine your eye. I'm going to turn the light on. It is very important to consider the safety of the ophthalmoscope. I'm going to I'm going to go close to the patient, and actually I'm going to hold his eyebrow up, and I'm going to watch his eye. I'm going to check the red eye reflex. And I saw that there is the red eye, which is red and bright circle right there. I'm going to go right through that, and I'm going to track one of the blood vessels. I saw that, and then I saw that I was able to see the optic disc, which was oval. I was able to see the optic cup, which was which was round. The disc and cup ratio was 0.3. The blood vessels were narrow, and not there was no tortuous blood vessels. There's no papilledema seen. There is no after that I also saw, though I saw no AB nicking. I don't see any cotton wick spots anywhere. I do not see any pigmentation on the retina, which is normal. Similarly, I'm going to examine his left eye also, and I'm going to see the same things. I'm going in, I'm examining, I see the red eye reflex, and then I'm going in, and I'm seeing that he has the blood vessels, and I'm following the blood vessels, and I see that the cup and the retina, and it all seems normal. This concludes my eye exam, ophthalmoscopic eye exam for him. And I'm going to now do the ear, let's see, the nose exam for you. On inspection, I see that your nose is straight and midline. The ala is equal. The septum seems to be equal. I'm going to flash some light. I'm going to palpate your nose first, and I don't see any lumps and bumps. There seems to be no trauma, no pain, right? I'm going to check into your nose, and I'm going to use my otoscope for that. And I'm going to attach this right here. Okay, I've got a new one here. Okay, well, it keeps falling, but I have a new one. So I'm going to get into your nose. I'm going to set my otoscope next to the ala, and I see that his nose canal is even. The septum is not deviated. There's no wounds. There's no drainage. I see the trabeculae is not swollen, and they are pink, and the meatus is present there. It's good. There's no drainage, no bogginess in the nose. I'm going to now check your smell. I'm going to have you cover your eyes and close one nostril. Cover your eyes, please. Yeah, and you're going to tell me what it is. Can you smell it?
Chocolate.
What do you smell? Chocolate. Thank you so much. And let's do the other nose now. And close your eyes, please. And try to take a deep breath. What do you smell?
Lemon.
Very good. Now I'm going to have you continue to do deep breath with this. In, out. And then we're going to do the other side. In and out. Very good. So then both his nostrils are patent, and he has good sense of smell. Thank you so much. That concludes my nose exam. Now we are going to go to your ear exam. I'm going to inspect the ears first. The ears pinna seems to be normal size, equal. And the tragus seems normal. I'm going to pull the ear, and you have pain here.
Yes.
Okay. And then do you have pain in your right ear?
No.
Okay. Now do you have pain on pressing this?
Yes.
And do you have pain on pressing
No.
Okay. Thank you so much. I'm going to examine your ear now. So safety is very important. Again, when I check the ears, for this one, I am going to actually examine with my ear. I'm going to put his pinna outside, and I'm going to put it backward, and I'm going to go right into his ear to examine it. And I see the ear canal. I see the ear drum. The eardrum is pearly pearly white, pearly gray, and then since this is his left ear, the cone of the light, I did see it in the 7 o'clock position. Saw the eustachian tube opening. I also saw the ossicles behind the eardrum and the cochlea. The ear canal was sort of little bit narrow because of probably secondary to the swelling. There is some redness there, and the patient did have some pain, but the eardrum is definitely gray and pearly. I do not see any infection or sign of infection there. The drainage was only slight and clear. Now I'm going to go on the other side and examine the other ear. I'm going to pull the pinna out and backward, and I'm going to stick my canal in. I see that the ear canal is definitely much more open here, and the ear eustachian tube is present. The eardrum is pearly and white. The rest of the structures are normal. After this, I'm going to check your hearing acuity. I'm going to check how well you hear, and it's also called the whisper test. I'm going to put my hand on your tragus, and I'm going to say a few words.
Basketball. Soccer 1, 2, 3.
Okay, good. So this was the whisper test, and he's able to hear very well. After the whisper test, I'm going to do, this concludes that his hearing is good. I am going to now go to checking the Weber test. The Weber test is done with the tuning fork, and I'm going to hit it hard on a surface, and I'm going to put it in the center of his scalp. You're going to tell me, sir, when you stop hearing it.
Stop.
I'm going to do it again. You're going to tell me if you hear it equal on both sides.
Yes.
Do you hear it equal on both sides?
Yes.
Okay, that tells that the Weber test is equal, and both his ears are able to hear equal on both sides. Now I'm going to do the Rene test, in which I will ring it again, and I'm going to put it in his mastoid bone, and we're going to see if his air conduction is more or bone conduction is more. Tell me when it stops.
No.
Does it stop?
No.
Good.
No. No.
Okay, good. So this was the Rene test, and for him also the air conduction is more than the bone conduction. After these tests, I'm going to proceed to his lips and his mouth. On examination, I see that the lips are even, symmetric. Give me a smile. Okay, open your teeth and give me a smile. I see his smile is symmetric, his teeth are symmetric, and they are pale white. If you can open your mouth, please. And I'm going to examine his ear canal from inside. I see that his dentition is even. There's no cavities. His gum line is even. There's no nodules. There's no growths. All the teeth are in place. There's no missing teeth. I see the opening of the salivary glands. I'm going to have you stick your tongue out, please. I see that this tongue is rough. There is no sign of infection, and he's able to pull it out. Let's move it twist it to the side, one side and the other side. I'm checking his cranial nerve 12. I'm going to have you push the tongue to one side against the cheek. This pressure, and then you're going to push it to the other side. I'm checking the strength of the tongue. Now I am going to also ask him to move the tongue to the roof, and I am checking the ventral surface of the tongue, and I see no sign of infection. I see there's a lot of venation. I'm also checking the base of the mouth, and there is no sign of infection or no growths there. I am now going to proceed to the roof of the mouth, and I see that there is a ruby there, and it is pale pink. If you're going to stick out your tongue out for me, just sorry about that. Soft palate. I see it in the back, which is pink and moist, and I see his uvula, which is hanging in the center of his mouth. It's okay. So then I'm going to. I also see that your tonsils are not swollen. They're only +1 stage, and they have no exudates. They are just like pink, not swollen. You don't have any pain, right?
No.
I do not see any discharge in the post-nasal pharynx, which is also a good sign. Then I'm going to have you open the mouth one more time, and then I'm seeing the uvula. Say ah.
Ah.
Okay. I saw the uvula going up and down when he said ah, which is checking the cranial nerve 9 and 10, which are intact for him, which is a good sign. This concludes his oral examination. Now I'm going to his neck examination. For that, I'm going to ask you, sir, to bend your neck forward, just like I'm doing, and then take it all the way back, extend, bring it to the side, and then to the other side. Awesome. Let's rotate your neck. Awesome. Thank you so much. And then I'm going to I'm going to have you pull your chair a little forward. Thank you so much. And then I'm going to go behind, and I'm going to check your 11th cranial nerve. So I'm going to have you shrug your shoulder and push against me. Thank you so much. Yeah, that's good. I'm going to also check your. After I've done that, I'm going to check your lymphatic ducts, lymphatic glands. So I'm going to start with the preauricular, and then I'm checking your postauricular lymphatic nodes. I do not see them palpable. I'm going to go along the mandible line, and I will check your mandibular lymphatic nodes and your mental lymphatic nodes. I don't see any of those. Now I'm going to go along your sternomastoid muscle here, and I'm checking your anterior cervical and posterior cervical. I don't see any of those, feel any of those. I'm going to go down, and I see the posterior clavicular lymph nodes. I don't see any of that. And then I see the inferior clavicular. I don't see any of those. So that means that you are doing very good. There's no sign of infection there. I'm also going to check your strength. So I'm going to have you move against my very good. And then this one. This is also the test that was supposed to be done with the shoulders. After this, I am going to check your thyroid. Actually, for thyroid also is better examined from the back. For thyroid, I'm going to actually first see from the front. I'm going to ask you the thyroid examine along the midline. This is the thyroid cartilage, the cricoid cartilage, the thyroid, and there's 2 rings of the trachea right here. I'm going to ask you to swallow. All right, I see that move. Then I'm going to go back, and I'm going to feel for his 2 rings of the trachea. I'm going to put my fingers right there. I'm going to bring them to the side, and I'm going to start palpating. I'm going to have you to swallow. Do you have any pain? Okay. And then I'm going to ask you to, I'm going to move my fingers to one side and then move it to the other side. I see that the thyroid is mobile, which is good. I don't, on tangential view, I do not see any swelling, so he does not have any goiter. After that, I am going to also I'm going to palpate it along this to check your thyroid. Are you going to swallow one more time? Okay, awesome. So the thyroid is normal. I'm going to also check your trachea, which is normal. While I was examining your head, I forgot to check your occiput, and then I also have check your occipital and also the lymphoid, the lymph nodes right here. That concludes our exam for head and neck today. Thank you so much for your help.
Very nice. Appreciate it.